An interesting case to show and progress evaluation. This is a class 1 slash class 3 tendency. You see, this is a class 1 here. And this side, if you look at the canine relationship and even the molar relationship, a little bit more class 3. And as with many patients that are class 3, there is going to be a fair amount of lower crowding that is combined with less crowding in the upper arch. So in the upper arch, there is some crowding for sure. I would call this moderate crowding, but I would definitely call this severe crowding, especially in this area. And that's because the mandible is more forward and the lower teeth are compensating to sort of bunch together to stay in a proper overjet relationship. There's a little chart here called a Bolton, and you could see this is a 2.6 mandibular excess, meaning that the lower teeth as well are wider in this particular case than the upper teeth are. And there are some teeth here that are on the narrow side, especially this premolar over here. And maybe even the centrals a little bit. And so in this case, when you look at it from the start, it's tempting to consider to remove a lower incisor. If you removed a lower incisor, you would have room to rotate this canine, line things up, and bring these teeth inward a little bit, which is generally good for a class 3 case. However, when you simulate a result, you have to look at the top and bottom together. And when I did simulate this, I saw that taking out a lower incisor would leave the lower arch in too much, but the upper does need some broadening. So now let me show you where we are at this time point, about a year later. Here we have a broader lower arc. Now, in order to broaden that, you have to broaden the upper too. But if you remember, there was a Bolton discrepancy. The upper teeth were narrow, and sure enough, the upper looks a lot fuller and nicer, which is huge from an aesthetic standpoint, especially in an older patient. This woman is in her 60s. And notice how there's some space here, here, and here. Now, this patient was explained to by me from the start that there would be some space left over, because if I try to close this space, I will further constrict the arch and it won't fit with the lower, because here's where she is now. And so you can plan this out ahead of time and communicate with the patient. She might leave these spaces, she's keeping them clean, or she might get a new crown on this narrow premolar over here. She might even do veneers on her upper front teeth. But it's very tempting when you're starting out with Invisalign, if you're an orthodontist, certainly not an orthodontist, to kind of worry about not opening up spaces. But sometimes it's really the way to go, because the spaces that are currently in this person's mouth, if you look right now, imagine this person just walked in as a brand new patient and they had these spaces and they didn't like it. You might think, hey, let me use Invisalign to close those spaces. That would be simple. I'll just sort of constrict the arch, but that won't work with the lower. You could do more lower interproximal reduction to allow the lowers to come in and then bring the uppers in too. But when you have a lot of dental wear, you don't want to bring the teeth in. You want to minimize the filing. And so, don't always think about space as an orthodontist or someone practicing Invisalign that is there that must be closed. Sometimes it's tooth shape, and sometimes the bite just won't allow that. So it's a good case to show how we have a fuller, nicer smile. And the trade-off is that we have some space on the top.